Hi, welcome to Mondays with M&M. I'm Meg and this is Maeve. And today we're talking all about chiropractic care, and we happen to be here with our chiropractor, Dr. Geraldine Mulhall Wright. And I'll be completely honest that I didn't go to a chiropractor before becoming pregnant. And I read an article about how it could benefit you while you're pregnant to help hopefully prevent like a breech, help keep the pelvic in line. And with me trying to have a home birth, I figured I needed to do anything I can to hopefully make that more successful. So I reached out to Dr. Geraldine. I was told that I needed to look into something called the Webster technique, and I found that she does that. So I met and talked to her and really just wanted to get a better understanding of why it would benefit me when I was pregnant. So I think I came to, if it wasn't first trimester, I think definitely second. So I think I came on a weekly basis through second and third trimester. Yes. But if you could let them know a little bit about why people come to you when they're pregnant, what the benefits they'll get out of chiropractic care would be.
So one of the biggest benefits that we find, especially with pregnancy, is that if your body is aligned, then you have a better opportunity to have the birth that you want. And there have been studies done.
Yes. Coming back over?
Yes. There have been studies that have been done that say average labor without chiropractic care is 12 to 24 hours. Average care with chiropractic is 8 to 12 hours. My patients usually have an average of 8 to 9 hours of labor time. So the possibility of reducing labor because your body is aligned and so your body does what it's supposed to do naturally is one of the biggest benefits that we find.
A huge benefit.
Yes, we like that.
Now tell them a little bit about what the Webster technique is and why, if they were pregnant, they'd want to find a chiropractor that does that.
So the Webster technique was designed, implemented, invented by Dr. Larry Webster, who was a chiropractor, whose daughter was also a chiropractor. She was adjusted all the way through her pregnancy and turned a breech, according to the way the story was told to me. So he said, we're missing something. And he took a look and found that what we were missing was the way the uterus is anchored into the pelvis. Is kind of like a hot air balloon. It's uterus, and then the ligaments and the muscles are like the strings that hold it to the basket, which would be your pelvis. If any of those things are out of alignment, then you have a more challenging birth process. So I've been practicing the Webster technique for over 15 years, almost 20, and it's been absolutely amazing in helping all of my moms make it through their pregnancies without so many challenges. That what all of those symptoms that everybody says is a normal part of pregnancy, not normal.
Yeah.
If your body was actually functioning well, you would not have a lot of those.
After Maeve was born, we actually brought her in when she was 3 days old. And again, as I was coming to see Dr. Geraldine, I learned about the benefits of bringing your child in as soon as possible and kind of the ongoing benefits too. So why would it benefit somebody to bring their baby in right after they're born?
Well, a lot of people don't realize that the birth can very frequently be the most traumatic thing that anybody does. It's a very hard journey on both mom and the baby sometimes. Yeah. And even under ideal conditions, there can be challenges for the child. Now, their brain controls absolutely everything, and it does it through your nervous system. And we think about getting the babies checked. They check their blood pressure, their breathing, their heart rate, their reflexes, all of those things. And as chiropractors, our specialty is checking the nervous system. So we go through and check the nervous system and find out what's going on with them, if anything. And then they're able to grow the way that they were meant to. And there's, obviously no drugs or other interventions involved with getting chiropractic care for children.
Which we love.
Yes.
Now, I know when I tell people that I take Maeve to the chiropractor and she came in at 3 days old, that they're instantly like, oh, you're popping her back. So just walk them through, give them a visual of what an adjustment looks like. I mean, I know you can't.
Yes, right.
Yeah, but
for an infant, they are not bony yet, so they should not have adjustments the way you and I get adjusted, right? So what I tell people is if you push your finger on your hand and your fingernail starts to turn white, that's how much pressure it actually takes to adjust an infant, and through toddler years as well. So what we're doing is retraining the nervous system, not popping bones. If you're popping bones on an infant, it can be highly inappropriate unless there's a very specific reason why that needed to happen. So any chiropractor who's trained in pediatrics, not just chiropractic, but chiropractic pediatrics, will know to use the appropriate amount of force and speed for any child. And so with the infants, we definitely want lighter.
So what I like about chiropractic care is that it's really looking at being proactive with your health and hopes to prevent the onset of multiple health issues. But I know you kind of had some bullet points as to what it could potentially, maybe not eliminate, but reduce, like if you get the flu or colds, or even babies having trouble sleeping. Like, kind of list off some of, you know, what it might help young babies, and then even kids as they're starting getting older too.
So a lot of times the symptoms that a child might have are actually signs that their nervous system is having trouble adapting to their environment appropriately. So things like colic and sleep issues, like you mentioned, torticollis, where they have their head tilted to one side or they can't look one way or another. If they're breastfeeding and they find it difficult to breastfeed on one side or the other, if they're pulling off, if they're having any diapers that are not normal, and things like that, where they're not hitting their milestones or they're just struggling. That's where we really want to take a look at the nervous system and find out what actually happened and how can we help them so that they are functioning better.
And sorry, there's a lot going on here with her. And then moving forward, oh, looky there.
Come on
she
over.
likes that. And then moving forward as she gets older, I mean, I know everybody's different, but what would you recommend? How often would you recommend someone coming in to see you, or is it an as-needed basis, or what would you say is this is the minimum? I know that's a tough question, right?
That's a really good question. So please understand.
Because I know everybody's different.
Yes, you're asking me as a chiropractor, but also as a third-generation chiropractic patient.
Yeah.
Okay. So my minimum to be checked. Careful, she's got
weekly
paper in her mouth. Yes. Would be weekly to get checked. Now that doesn't mean that they would necessarily need to be adjusted every single time. The adjustment, if we're doing a very scientific, specific chiropractic adjustment on anyone, then the body's ability to adapt to their environment on any given day is going to be different. But if you want to get checked, I recommend at least once a week and at a minimum twice a month.
A minimum twice a month. I know. I put her on the spot with that question. I knew instantly when I asked. She's like, "Don't ask me that." But we try and do weekly. But I would definitely say a minimum of we come in twice a month, just to, even if nothing's going on, just to keep her and myself in check with breastfeeding and running around with her now that she's crawling and soon to be walking. But
because there's so much growth going on in the beginning.
Right.
We want to make sure we're catching anything before it becomes an issue for them.
So I guess the whole gist of it would be anybody can get chiropractic care. Babies, adults, kids. It's to really be preventative and to help keep the body in check so everything works properly.
Yes, 90%. Yeah, 90% of your entire nervous system is actually dealing with proprioception, where your body is in space, and function. 10% of your body's nervous system is dedicated to sensation, pain, and symptoms. So by the time you have the symptoms, you've already gone past that 90% of being function. Okay. So yes, if you want to use it appropriately, then make sure that you find somebody you can bond with. Right. Because if you can't bond with them, if they can't hear you, then you're not finding the right practitioner for you.
And I will say, whenever we come in and get adjusted, using that term loosely adjusted, she's so peaceful and calm and sleeps so amazingly afterwards. So, thank thank you for being here with us today. We appreciate it. And I will, again, post a lot of this information on my website. So if you do live locally, I'll make sure her information is there as well. And thanks for joining Mondays with M&M. Have a great day.
Bye.